Hi YouTube, this is the IHF team. We are a medical scientist, an engineer, and a healthcare technologist. Welcome to our channel. The Immunohematology Framework, IHF, a universal operating model for the blood transfusion domain. This is the next video in the IHF series. The Transfusion Risk Group, Story, Concept, and Application.
Hi, this is Elena, Butina. In my job as the head of an immunohematology laboratory, I have often been called upon to help physicians choose the tactics to be employed in transfusion therapy, especially when they are confronted with a complex case. The need for a concise, simple, accurate, and fast approach led me to the idea of creating an information model that can determine the ideal selection of red blood cell units for transfusion patients while simultaneously optimizing the long-term blood bank inventory. Presentation topics. In this video, we will be introducing a new patient classification scheme, the Transfusion Risk Group. We will discuss the 7 transfusion risk groups, reviewing their definitions, criteria, and phenotypes. We then explain IHF patient profile both at the individual and collective levels. Then demonstrate through the IHF pilot project a real-life application of the TRG concept. We conclude with showcasing TRG's use throughout the IHF framework and the capabilities it enables. We begin this discussion by introducing a new patient classification scheme, the Transfusion Risk Group. What is a transfusion risk group? What are the ideas behind the TRG concept? How does it work? This section has answers to those questions and more. Transfusion Risk Group. Objective. One of IHF's main functions is the prevention of the emergence of clinically significant alloantibodies, alloimmunization, that result from red blood cell transfusions. The objective of correct donor selection is to consider both current transfusions and those that may occur in the future. To achieve this, blood recipients are assigned to a TRG, which yields the information necessary to properly evaluate transfusion safety and efficacy. TRG, new concept. What is this new mechanism called TRG designed for? IHF summarizes the patient's blood transfusion-related story via its TRG classification scheme. TRG combines relevant patient demographics with transfusion conditions, and using this information, it assigns patients to groups that indicate donor selection level by phenotype. TRG classifies the patient by defining required patient-donor matching conditions. It is imperative that donor selection be performed to prevent the formation of RBC antibodies so that the patient does not transition to an alloimmunized state and is not exposed to any new specific antibodies produced by their own immune system. To accomplish this, recipients are assigned to risk groups. Transfusion Risk Group, TRG, is a new concept developed as a classification scheme. This provides a method for grouping patients according to their relevant demographics and transfusion conditions and defines the antigens required for patient-donor matching. Now, let's discuss the TRG classification sources. The classification is based on published research data of alloimmunization frequency during blood component therapy amongst patients with various diseases, and also a probability assessment of the observed consequences of alloimmunization like hemolytic transfusion reactions and hemolytic disease of the fetus and newborn. The important question is, what data is required for the TRG mechanism to work? Classification data. TRG classifies patients based on 3 categories: demographics, clinical, and laboratory. Demographics data includes gender, age, and race. Special attention is given to young women whose alloimmunization prevention is targeted to the prevention of HDFN. Clinical information includes diagnosis, circumstances that the patient requires a chronic transfusion of blood components, and use of anti-CD38 monoclonal antibodies. Special attention is required for recipients with blood system diseases and long-term transfusion therapy, who require the selection of RBCs for the prevention of HTR. Recipients using drugs that cause nonspecific RBC agglutination require extended phenotype matching donor selection. And finally, laboratory. Laboratory includes the presence of specific antibodies, nonspecific antibodies, and multispecific pan-agglutinating antibodies. If specific alloantibodies are detected in the recipient, selection is carried out using RBC of the phenotype, where there is no antigen to which the patient's antibodies are directed. If nonspecific and/or pan-agglutinating antibodies are detected, selection is carried out according to the extended phenotype matching principle. Now, let's briefly discuss the defined risk groups and review a complete TRG classification chart. 7 risk groups. There are 7 defined risk groups. Each TRG is associated with an algorithm to determine if a patient's blood typing antigen information is sufficient for donor matching and with a method to perform patient-donor matching. The TRG classifications are enumerated 0 through 6. TRGs 1, 2, 3, and 6 are defined according to the required antigen level matching rules. TRGs 4 and 5 additionally consider unexpected RBC-specific antibodies. These rules are used by the patient to donor matching process. TRG 0 is reserved for the situation when patient phenotype is unknown and immediate transfusion is required. In what form was the TRG concept introduced? Here is the complete TRG chart. In the next section of this presentation, we will provide a detailed review of each transfusion risk group and explain how TRG works. We will now discuss transfusion risk groups, summaries, definitions, criteria, and phenotypes. Transfusion risk group 1. Definition: the prevention of alloimmunization is limited only to transfusion-dangerous antigens, ABO, D, and Cal. Donor selection that makes use of a greater number of antigens does not have clinical significance and increases the cost of the transfusion. These patients likely will not receive subsequent transfusions or have a change in their transfusion conditions. Criteria: all males and females 55 years and older who do not possess any negative transfusion conditions. Phenotype: ABO, D, and Cal. 3 antigen rules. Antibodies: none found. Transfusion risk group 2. Definition: patients have a high probability of future transfusions or pregnancies. The prevention of alloimmunization in addition to ABO, D, and Cal includes big C, big E, and little e antigens. The 7 antigen rule. Criteria: females who are younger than 55 years old, or patients that have blood disorders, or patients that undergo chronic transfusions due to other diseases. Phenotype: patient-donor matching is based on 7 antigen rules. Antibodies: none found. Transfusion risk group 3. Group definition: lifelong blood transfusion dependency. It is a better course of action to prevent alloimmunization rather than to fight against the consequences it creates. For TRG3, donor selection should be based on 13 antigens, and patient blood typing should be performed according to this level. The criteria for TRG3 is patients with disease diagnoses such as sickle cell disease, thalassemia, chronic myeloid leukemia, and myelodysplastic syndrome. Phenotype: patient-donor matching is based on 13 antigen rules. Antibody: none found. Transfusion risk group 4. Definition: the patient has unexpected specific RBC antibodies. In these cases, donor selection must consider both a base of 7 antigens, the same as TRG2, as well as additional antigens corresponding to the patient's antibodies. Criteria: the presence of unexpected specific RBC antibodies. Phenotype: patient-donor matching is based on 7 antigen rules and antigens according to the specific detected antibodies. This next group to discuss is one of the most challenging. Transfusion risk group 5. Definition: the patient has unexpected specific RBC antibodies and additional transfusion conditions. Donor selection must consider both a base of 13 antigens, which is the same as TRG3, as well as the additional antigens that correspond to the patient's antibodies. Criteria: presence of unexpected specific RBC antibodies in disease diagnoses, such as sickle cell disease, thalassemia, chronic myeloid leukemia, and myelodysplastic syndrome. Phenotype: patient-donor matching is based on 13 antigen rules and antigens according to the specific detected antibodies. Transfusion Risk Group 6. The definition of TRG6 is: patients have pan-reactive antibodies possibly introduced from prescribed medicines. These antibodies interact with the RBC of all donors. Donor selection should be based on 14 transfusion-dangerous antigens. Criteria: presence of multi-specific antibodies. Phenotype: patient-donor matching is based on 14 antigen rules. Antibody: multi-specific antibodies. The last group to review is Transfusion Risk Group 0. TRG0 is reserved for the situation when patient phenotype is unknown and immediate transfusion is required. Criteria: immediate transfusion, phenotype is unknown, or no matching identical donor unit is available for ABO and RH. Phenotype and antibody information is not available. In the previous sections, we discussed the transfusion risk group concept, data, and detail specification. In this segment, we present its application, IHF patient profile. IHF analyzes demographic, clinical, and laboratory information and assigns a TRG, creating an individual patient profile. TRG also provides a mechanism to create and analyze the snapshot of a service area. We call this a collective patient profile. What information does it include? Let's review. The patient profile content is used for IHF decisioning and analytics. It includes demographics, clinical, and laboratory information. Also, transfusion conditions which are derived from the relevant reported information. Next is assigned TRG, which is determined by matching patient information to TRG classification. As expected, phenotype information is included in the profile. Importantly here, we can also see the required level and specifics of recipient phenotyping for the purpose of donor selection. The next item is blood typing information sufficiency, which is evaluated against TRG requirements. Additionally, system-determined impossible, improbable, and rare antigen combinations. And finally, double population DP condition and autoantibody presence. Now, we are ready to watch the demonstration of patient profile using the IHF system.
Hi, this is Gennady, the IHF framework architect. The system is a component-based framework. These components can be used independently or in combination with each other. The patient profile module creates an individual patient summary using available patient information and TRG classification. I will now present the user experience of this component. Individual patient profiles, and the service area snapshot, which we refer to as the collective patient profile. For this demonstration, we will use 22 demo patients mirroring a sample of pilot project information. Let's begin. This is the patient profile component main screen. First, we will take a look at the individual patient profile. We navigate to the patient search screen. You see the 22 demo patients? Here we have the ability to filter using multiple search conditions. Let's use the transfusion risk group filter. Applying TRG5, the most challenging risk group. You can see the 5 patients that meet this criteria. Let's use the information function to remind ourselves about the TRG5 details. We are in the TRG reference screen. Here we can select group 5 to see the information, including the 5 transfusion conditions. Now let's return to patient search. We are at the patient search screen. We are going to select a TRG5 patient. Let's select the first patient in the set. Source ID 14. This is a 41-year-old white male with blood type of A+. Choice depth equals 19. What is choice depth? Choice depth is the IHF term for the number of antigens. In this case, patient choice depth is the number of antigens. for which the typing information is available. Now let us select this patient. Profile button is activated, navigating us to the next screen, where we can review his IHF profile. You see the demographics information, medical facility and IDs, transfusion conditions CML, which is derived from the ICD code C92.1, and unexpected specific antibodies transfusion condition. Assigned Transfusion Risk Group 5, its definition and phenotype matching recommendation. Also patient phenotype, 19 antigens, patient choice depth equals 19. System determined that sufficient information available for donor selection. We have finished reviewing the patient profile. Let's now return to patient search. Let's clear the filters. We are back to 22 records. Now let's navigate to the main menu. We have demonstrated the individual patient profile and will now move on and present the service area snapshot, what we call the collective patient profile. We begin again at the patient profile component main screen. From here we navigate to the analytics main page. We select a specific date to view the patient-based analysis, and then we navigate to the operational history. 22 patients aggregated by various groups. Transfusion Risk Group 5 contains 5 patients. We can see the group's collective profile summary, grouped by facility and demographics and transfusion condition. Clear filters. Returning to the full set. We are still in analytics. Now let's explore further. We will move on to the patient medical detail page. 22 patients grouped by international classification of diseases and transfusion condition. Let's select Transfusion Risk Group 5 and see the details for this group. Clear filters. Patient phenotype information is next. Antibody distribution. 9 patients have antibodies. Let's choose an antibody example. We see 1 record. Next filter is the number of antigens for which phenotyping information is available. Let's select choice depth equals 19. We see 2 patient phenotypes. It is possible to identify patients who have insufficient information for donor selection. This situation is associated with a type 1 message flag. Once again, the patient phenotype screen displays antibody and choice depth information and, importantly, system messages. Finishing with patient profile, we navigate to main menu. Let's recap. We reviewed service area snapshot and individual patient profile. We also explored the information function browsing TRG reference data. This screen is where other IHF concepts also can be viewed. This concludes the demonstration of the collective patient profile. Now from demo to real data. In this section, we present the first component used in the pilot project. Here we cover the TRG concept using the IHF system and real-world data. Pilot project, the Transfusion Risk Group at work. Pilot overview. The IHF completed a pilot project at a European research laboratory. The system processed 3 months of operational data from the lab's specialized blood disorder medical unit. The first set of pilot project data includes patient, donor, and blood bank inventory information. This dataset consisted of 109 active patients and 484 active donors. It also contains 914 refrigerated and cryopreserved RBC units. The second set of pilot project data includes 193 RBC unit selection decisions made by the laboratory physicians. In this video, we present only the patient base analysis to illustrate the application of the transfusion risk group concept. Patient base analysis. Objectives. First, the processing of patient's information and the assignment of each patient to a TRG. Second, the creation of an individual patient profile. And finally, the creation of a collective patient profile with special attention to patient distribution by TRG. Patient base analysis. Data. Demographics. The pilot included 58 men and 51 women aged 1 to 89. Due to the regional population's racial makeup, all patients were white Europeans. Transfusion conditions were widespread. Specific antibodies. 9 patients had unexpected specific antibodies. Double population DP. 3 patients had double population. We can now see the Transfusion Risk Group at work. The IHF pilot project achieved its defined objective. The pilot system analyzed the medical unit patients. Patients' profiles were created. All patients included in the pilot were assigned to one of the 6 TRGs. These patients were assigned to a TRG by matching patient transfusion conditions to TRG definitions. All 6 groups were represented. TRG2 and TRG6 had the highest number of patients. Patient blood typing information sufficiency, phenotype, was validated against assigned TRG requirements. 1 patient had incomplete information. Now that we have concluded the pilot review, let's highlight some important points about the IHF. TRG is a foundational framework concept that powers it. Patient-donor phenotype matching method relies on TRG. The system's analytics engine also identifies patients assigned to TRGs 3, 5, and 6 who undergo ongoing transfusion therapy. RBC donor phenotype is classified largely according to TRG definitions. This concludes our presentation.
We hope that you found this video interesting. Please subscribe to this channel and watch our other videos, which dive deeper into blood transfusion domain challenges and the IHF solutions that solve them.